If you are 23 weeks pregnant, you may have a lot of questions like, how is your baby developing right now? What kind of tests will your doctor order next and what are they for? How to help with second trimester problems like back pain, hot flashes, constipation, and we're going to talk about that and more right now. But first, if you're new here, my name is Diana and I'm a physician assistant. I specialize in women's health and gynecology. You're watching In the Pink, and if you're new here, In the Pink means in good health and spirit. So if you like being healthy and happy, click subscribe because you're in the right place. At 23 weeks, your baby's measurement from crown to rump, meaning the head to the bottom, measures around 8 inches. Now, if you measure head to heel, that's around 11 inches, so almost the length of a 12-inch ruler. At this point, your baby usually weighs around 1¼ pounds. You are going to see that your baby is going to gain weight at a much greater speed than they did earlier. You are over halfway through your pregnancy and your baby still has a lot of weight that they will be gaining. And in fact, up until now, your baby really hasn't been developing a lot of fat cells. So their skin is really wrinkly and really saggy. But now they're starting to develop fat cells and they're going to start filling in and plumping out your baby. In the next 4 weeks, expect your baby to double in weight. And up until this point, your baby appears kind of purplish because their skin is so thin and transparent. But as those fat cells start to grow, the skin will be less transparent and their skin will start to look more and more pink. They are also moving more and more, and kicks and punches are starting to get really strong. By now, you might even be able to see your baby kick if you lay down, you keep really still, and you pay attention. The baby's lungs are still really mature and won't be fully mature until around 37 weeks, but your baby is practicing their breathing motions in order to prepare for their first breaths. And when they're doing this, they're actually moving amniotic fluid in and out of their lungs. Also, the blood vessels in their lungs are developing, and soon they're going to start producing something called surfactant. And this is a vital substance that your lungs make to prevent your air sacs in your lungs from collapsing when you exhale. Now, I talked about Braxton Hicks contractions in my 22-week video, but I want to talk about preterm delivery for a minute. So if a baby were to be delivered at 23 weeks, approximately 1/3 of those babies can survive. And out of those 1/3 babies that survive, 60% of them are going to have some sort of severe disability because they were born so early. And of course, you don't want your baby to be born this early at all. But it's kind of a milestone once you reach 23 weeks because you know if your baby were to deliver this early, there is a very small chance that they could survive and be perfectly fine. But again, you definitely want to keep your baby cooking till they're full term. As for you, you are well over the halfway mark. You are 5 months and 3 weeks and you only have 17 weeks to go. Your uterus is about 1 inch above your belly button, and at this point, if somebody didn't know you were pregnant and they saw you, they could probably figure it out. So you are definitely starting to show a cute baby bump. On average, weight gain by 23 weeks is usually about 12 to 18 pounds. You're still in the second trimester, and for most of us, this is when we feel the very best. But there are definitely some things that you might be noticing that can slow you down. The extra weight that you're carrying can start to take a toll on your body, particularly in your hips and in your back. And this can make you pretty sore and achy. Maternity belts are great for offering support. Your center of gravity is also shifting, so just remember to take it easy and be careful. You might also start to notice a lot of hot flashes now. You have a bun in the oven, and that oven can make you feel hot, like all the time. Now, if your second and third trimester falls in the winter months, you can easily cool down by opening a window or wearing lighter clothing. If it's summer, you literally just do whatever it takes to stay comfy in the heat. And that totally means no judgment, we understand. Do whatever it takes to stay cool. All 4 of my pregnancies, the last trimester was in the summer, so I get it. Some things I recommend: have a fan on hand, always if you can. And the kind that sprays mist on you is even better if you're outside. Wear comfortable, loose-fitting clothes, and wear clothes that are layered so you can shed a layer if you get too hot. One really cheap option that works wonders for hot flashes is a cooling towel. And you can get it wet and you wring it out and then you drape it around your neck and your shoulders and it stays cool and it's really refreshing. I highly recommend getting one, especially if you're going to be in your second or third trimester in the summer. I will link to one in the video description down below. Definitely check it out. Also, the thermostat, it's there for a reason, and if you're really hot, you can always turn it down, and if anybody tries to tell you anything differently...
Hey sweetheart, don't you think it might be a little cold in here? Okay then.
At your next prenatal appointment, your OB or midwife might order a blood sugar test to screen for something called gestational diabetes. This is a common problem during pregnancy, and it affects anywhere from about 2 to 10% of all pregnant women. It's recommended to be screened for gestational diabetes anywhere from 24 to 28 weeks. Your OB or midwife might also check a blood test called a CBC, which stands for complete blood count, to screen for anemia and other problems. Anemia is fairly common in pregnancy, and in fact, because of that, most prenatal vitamins have iron in it. But sometimes your OB might want you to take some extra supplements if you need it. Just as a side note, iron supplements can cause constipation. Sometimes even iron in your prenatal vitamins can cause constipation. It totally did for me. So if you're feeling a little backed up, try getting more fiber in your diet. So like fruits and vegetables, kidney beans, quinoa, oats, things like that. And if you're still feeling constipated, over-the-counter Colace and Miralax is safe in pregnancy, but talk to your OB first just to make sure they're cool with that. If this is your first time here and you haven't seen them yet, first make sure to hit subscribe and then go check out some of those earlier pregnancy videos. There's a ton of good information. I highly recommend that you go check them out. Also, just want to remind you, these videos are intended to be educational and informative. They are not intended to diagnose or treat you. I highly recommend that you continue to go to all of your prenatal vitamins and to take the advice of your own OB. At the end of this video, or right here, I am going to link to my week-by-week pregnancy playlist. Click on that playlist and I'll see you over there. You can actually push on your belly, and if the baby feels that push, they might kick or push right back. Sometimes when you're at your OB appointment, if your OB is listening for the heart tones or they're doing an ultrasound, the baby might kick that ultrasound probe, and you might be able to see that on ultrasound.